At this very moment, tonight, there is a high-stakes battle underway in the nation's capital. It is an arm-twisting, vote-wrangling, down-to-the-wire, choose-your-cliche effort to get health reform passed. Senate Democrats trying to hold off Republicans while keeping their own conservatives in line. That's the battle on health reform that's happening on the surface. Just below the surface is a battle for public opinion that is being shaped by a lot of different interest groups, but by some groups in particular that are trying to shape the debate while disguising their own role in doing so. As health reform proceeds and these folks get more desperate and more sloppy, some great investigative journalism done recently by the Associated Press, by the Center for American Progress, and by Mother Jones Magazine has uncovered some of the inadvertent hilarity in who's behind the opposition to health reform. If you happen to be an avid viewer of the Fox News channel, you're probably not watching me right now, but let's say you are. You have probably seen lots of analysis on health reform on Fox News by a Fox News medical contributor named Dr. Mark Siegel.
Millions of people are going to lose their current health insurance in favor of this government insurance. The government can regulate the amount of care that's delivered. That's also known as rationing care, by the way.
Rationing care. Millions losing their insurance. Fox's Doctor, the Government's Trying to Kill You, Mark Siegel, was reportedly a senior fellow at the time he made those comments at something called the Center for Medicine in the Public Interest, CMPI. The Center for American Progress today documents how CMPI has been a big player in the anti-health reform movement over the past few months. They've sponsored anti-Obama Tea Party protests. They have organized a U.S. policymaker series that hosts anti-health reform interviews with a not-so-broad range of Republican lawmakers, including Michelle Bachmann, Joe Uli Wilson, Jim DeMint, David Vitter. They've produced a number of anti-health reform online ads and videos and even anti-health reform video games. So, shocker, right? Fox News' medical contributor was a member of a staunch anti-health reform organizing group, this CMPI. But it might also be useful to know that CMPI has also been funded in part by the pharmaceutical industry. According to Politico.com, CMPI's biggest contributors in 2006 were the drug maker Pfizer and Pharma, the drug industry's trade group. Who runs CMPI, the Center for Medicine in the Public Interest, this group? Well, its president is a man named Peter Pitts. In addition to heading up this ostensibly nonpartisan medical think tank, Center for American Progress notes that Mr. Pitts is also the director for global health care at the giant PR firm Porter Novelli. Porter Novelli, of course, has a bit of a history when it comes to shilling for the health insurance industry, having helped that industry kill the Patient's Bill of Rights way back in 1994. They said at the time that it was part of a, quote, big government agenda. Why does that sound so familiar? CMPI, of course, would not tell the Center for American Progress who is funding them, but it is true that they sprung from a famous pro-tobacco, ostensibly grassroots corporate front group that was funded by Philip Morris. So we leave it to you to make your best educated guess as to who is funding their current anti-health reform agenda. Meanwhile, the Associated Press this weekend shined another big, bright spotlight on yet another group, this one called Americans for Quality and Affordable Health Care. Sounds great, right? I mean, who doesn't want quality and affordable health care? If you think you'd like to be a member of this group, good luck joining. At the group's website, you'll see lots of very happy, sunny pictures of doctors and healthy kids and test tubes. You'll find plenty of talking points about why we cannot afford a government-run healthcare system and how essential it is that every American be forced to buy health insurance. What you won't find is any phone number or address of who runs Americans for Quality and Affordable Healthcare. It's just a generic contact us form on a website registered to a hide the website's owner's proxy site. Turns out Americans for Quality and Affordable Healthcare, despite the charming clip art, is not really run by doctors and nurses. The Associated Press connects Americans for Quality and Affordable Healthcare to a North Carolina law firm that's called Moore and Van Allen. They have a big Beltway PR and government affairs practice. The law firm acknowledges running the site on behalf of its healthcare clients, but they won't specify who those healthcare clients are. A spokesman for the law firm telling AP, quote, they want to stay in the background and off the front page. No kidding. So Moore and Van Allen won't say who funds Americans for Quality and Affordable Health Care. But with talking points like no public option, but everybody must buy private health insurance, it's not that hard to imagine who might be behind this one. There's also one other group. They're called the Association for American Physicians and Surgeons. You might want to sit down for this one, okay? Just fair warning. While some anti-health reform front groups appear to have some financial corporate incentives to try to kill health reform, the motivation of this last group appears to be more ideological. The Association for American Physicians and Surgeons has been busy in recent months. Back in September, they organized a rally on Capitol Hill ahead of the big Glenn Beck 9/12 march. Their annual meeting last month featured, among others, Republican anti-health reform congressmen like Tom Price and Paul Brown. Members of the group have also appeared on, you guessed it, Fox News to slam health reform.
Americans can stop this. They need to call Congress, and they can go to places like DoctorsForPatientFreedom.com. They can go to freedomworks.org. If hundreds of thousands of people call the senators in their own district, this government takeover of medicine will stop.
That was Florida Dr. David McCaleb, a member of the Association for American Physicians and Surgeons, who you might remember as also being the guy who mass emailed this image of President Obama around, the one with Obama as a witch doctor with a bone through his nose who's also somehow secretly a communist. That sort of subtlety turns out to be par for the course for this rather benign-sounding organization. I mean, again, they're called the Association for American Physicians and Surgeons. It sounds really mainstream, right? Well, great reporting by Mother Jones Magazine today reveals some of the causes that this group propounds. The group's statement of principles, for example, declares that it is evil and immoral for physicians to participate in Medicare and Medicaid. Its website features claims that electronic medical records are a form of data control, like that employed by the East German secret police. An article on the group's website speculates that Barack Obama may have won the presidency by hypnotizing voters, especially cohorts known to be susceptible to neuro-linguistic programming. That is, according to the writer, young people, educated people, and, wait for it, possibly Jews. Yeah. Here's that actual article. I'm not kidding. I swear it's real. Oratory or hypnotic induction? Remember that scandal where Lou Dobbs got caught peddling that insane conspiracy theory that illegal immigrants had caused a leprosy epidemic in the U.S.? That was these guys, too. That was in their journal. This is the group that's providing the medical experts for the Glenn Beck specials against health reform on Fox News. This is the group that's providing the doctors in white coats at the anti-health reform Tea Party protests. This is the character of some of the highest profile current opposition to health reform in the country, which might explain why we're closer than ever to getting health reform in this country. All of these groups have every right to do what they're doing. We also have every right to tell you who funds them and what wacky conspiracy theories they propound. And no, we have not been neuro-linguistically programmed to do so. At least I don't think we have.